Pharmaceutical Science, Konkan University. She will give a talk on plumbago induced histopathology and lipid peroxidation in the mouse livers. Please.
Good afternoon, everyone. My name is Nadta, a master degree student from Faculty of Pharmaceutical Science, Konkan Universities. Advisee of Associate Professor Dr. Kanokwan Jarugamjong and a member of a research group for pharmaceutical activity of natural product using pharmaceutical biotechnologies or PAN-PB. Today, I would like to present in the topic of plumbago indica and plumbagen-induced lipid peroxidation in mouse liver. First, let me introduce to the outline of my presentations. I will begin with the basic information of plumbago indica, plumbagens, and lipid peroxidation. Then, I will move on to the objective of this study methods, results, and lastly, conclusion and discussions. Let's start with plumbago indica. Plumbago indica is the flowering plant known as scarlet leopard or Jetamoon Pleung Dang in Thai because of its raised flower. It's a member of Plumbaginaceae family and found worldwide, including Africa, Australia, and Asia, especially in India and Thailand. It was traditionally used to treat diarrhea, indigestion, skin disease, used for anti-helminth, appetite stimulant, antibacterial, antifungal, and for abortion. It contains plumbagen as its main active constituent, which the plumbagens or 5-hydroxy-2-methyl-1,4-naphthoquinones is a yellowish quinolone compound found in several plants. It's an active constituent in plumbago species, so which is where the name plumbagen came from, and is found especially high in P. indica roots. It's reported to have several biological benefits, including anti-helminth, anti-malarial, antibacterial, antifungal, anti-inflammatory, immunosuppressive, and abortive, also anti-cancer and anti-diabetes. However, it's reported to be hepatotoxic, cardiotoxic, and radiomimetic cytotoxicity as well. From there, I will focus on hepatotoxicities. Regularly, the liver is the major organ responsible for metabolizing xenobiotic for excretion. However, during the metabolism process, free radicals are produced. In our body, there's contained the balance of free radicals and antioxidants to protect it from free radical damaging cells. This balance is called antioxidative system. However, when the balance is shifted and the free radical is accessed, the capacities of antioxidant imbalance is called oxidative stress. As I explained earlier, the liver has the main responsible in metabolizing xenobiotics. So the high amounts of free radical are produced and also can be accumulated in the liver. So that's why the liver has to have antioxidants to change these free radicals to non-toxic waters and oxygens. But whenever the free radical is excess the capacity of antioxidants, it will occur oxidative stress, which the oxidative stress can cause oxidative damage to cellular components, including cell lipid bilayer membrane. These cell membranes are oxidized to be lipid peroxide called malondialdehyde or MDA, which MDA can be used as biological markers to measure lipid peroxidation. And also, when the oxidative damage to the cellular components is called hepatoinjury and can be observed by histomorphological change under light microscope. So for the study objectives, To study the effects of P. indica and plumbagins on my hepatic lipid peroxidations and histomorphologies to assess their hepatotoxicity potential. Okay, for the study method, the protocol for animal handling and treatment are already approved by the animal ethics for use and care of Khon-Kaen universities. The adult male ICL mice were divided into 3 groups. The first group is the control group, was intragastrically given 0.5 carboxymethyl cellulose as the vehicle only, and the second group was given 1, 5, and 15 mg per kilo per day of plumbagent, and the third group receiving 20, 200, and 1000 mg per kilo per day of P. indica extracts. All groups were treated daily for 14 days, and then the mice were sacrificed and the liver are collected. And this liver were elevated for MDA formation to access lipid peroxidations and examine histomorphological to access histopathological change under light microscope. Which MDA formations can be measured by adding thiobarbiturate acid or TBA, and then TBA will be combined with MDA, and from MDA TBA at the given pinkish color and can be analyzed by using spectrophotometry, and histomorphologies can be examined under light microscope. And next is the results of this study. This figure shows the MDA level or the MDA formation that is representative of lipid peroxidations. When compared to the control groups, both plumbagins and P. indica increase in MDA level as a dose-dependent manner, suggesting that the oxidative stress and lipid peroxidations can be induced by this compound. And for hepatic histomorphology, as the lowest group, plumbagins and P. indica didn't show any changing of histomorphological change when compared to the control groups. However, in the higher group is shown the hepatocytes show karyopignosis or nuclear shrinkage is resulting from the condensations of chromatin as the early signs of necrosis or apoptosis as indicated with the white arrow. And hydrophic swelling or intracellular edema as indicated with the black arrow resulting from decreasing of ability of cell membrane to maintain proper permeability. While the highest dose of both plumbagins and P. indica hepatocytes show poor demarcations between hepatocytes, that indicated the disruptions of cell membrane. So let's move on to the last section of my presentation is the conclusion. Also for the conclusion, the P. indica and plumbagins trends to be produce hepatotoxicity and hepatocellular injury, where an increase in free radical productions resulting in oxidative stress and lipid peroxidation indicated by MDA level and histomorphological change. Hence, it is of concern for the high dose and long-term consumptions for the product containing this compound, especially for the patient who undergo on the hepatic disease. Lastly, I want to thank Associate Professor Dr. Kanokwa Jarukamjon, Dr. Waranya Jatuphon Praset, Pan PB KKU Research Group, and Faculty of Pharmaceutical Science, Khon University. For this research serve great benefit in ethnopharmacology regarding to the toxicity of plumbagens and tobacco vinegar. Thank you.
Any questions from the floor, please?
Actually, the plumbagen is not commercial because it is on the research, especially for the anti-cancer agents. Now it's on the process because it have very potential. If we use for the small amounts, it can be the anti-inflammatory or also in anti-cancer. So it's not now in commercial now. Oh, not yet. In the hospital, the doctors give it only the traditional remedies that contain plumbago indica in there. It's not the pure plumbagen in those remedies. Yes.
For the results, the lipid peroxidation reveals histopathology of it's not appropriate method to evaluate lipid peroxidation. We can use such as enzyme.
This is only a part of my thesis, so I just pick up the lipid peroxidations. But in the total thesis, I already used the enzymatic for in hepatics to evaluate, co-evaluate as well.
So when you conclude the results between the extract and I don't know the other derivative of the chemicals in the extract. You choose to or derivative may come from another derivative to induce genetic degeneration.
From now, there is the report that the plumbagen is the hepatotoxic. So I use the plumbagens to compare and taste whether the plumbago indica contain this two that is have the same results or not.
The results they have the gap different between the extract and the modified chemical.
Yes.
In this gap, this may be from the another derivative of in the extract.
Thank you for your suggestion.
How do you choose the dosage for study and how it can be related to the dose used in human?
Oh, the dose that I choose and start from the P indica. P indica I choose the dose from the preliminary study that is have not have non-systemic review as well. So I choose 20, 200, and 1,000 to cover the long-term and the high dose. Is quite related to the use in human right now because now the plumbago indica use average 1 to 20 milligram per kilo per day and suggest to use not more than 1,000 milligram per kilo per day. That's the dose that I should is cover the range between the lowest and the highest that the national drug lists are suggesting.
Any more questions? Yes.
According to your introduction, P indica is seem to be good because you said that it's an antioxidant, and I'm wondering that why it was the hepatotoxicity. Could you please explain?
For the introductions, I mentioned that P indica used to treat diarrhea and especially used for antihistamine, antibacterial, but not mentioned about the antioxidants. But I think is cause the hepatotoxicity is may come from the main active constituent that contain plumbagens that report to be hepatotoxicities, but it may come from another constituent that the professor already suggesting as well.
I think we time up. And thank you very much for